Another case of coronavirus has been detected in our country, taking now the toll up to 29. An employee of the digital payment platform Paytm has tested positive for coronavirus. In fact, the company itself has issued a statement confirming this development and has now advised its employees in Gurugram and Delhi to work from home. Ayushman is joining us with more details. Ayushman?
Yes, Tanvi. In fact, Paytm has said that this person who joined the office today was today sent to Safdarjung Hospital, and then it was confirmed that he was infected by coronavirus, and by this, the Health Ministry has clarified that the final tally of people infected by the coronavirus, confirmed cases, has gone now up to 29.
All right, so this is a Paytm employee who was on leave and turned up to work today, joined back today, but was then sent home after they figured that he had tested positive. In fact, I'm just going to read out that statement where Paytm spokesperson has said one of our colleagues based out of the Gurgaon office who recently returned from Italy post a vacation has sadly been tested positive for coronavirus. He is receiving appropriate treatment and we're extending complete support to his family. As a precautionary measure, we suggested his team members to get health tests done immediately. We've also advised all our colleagues to work from home for a couple of days while we get our offices sanitized. However, there will not be any impact on daily ops and Paytm services will continue. So this is the latest update. Now, the number of positive cases in India, the fresh ones, has gone up to 26, in all 29. Welcome back. Over the next 60 minutes now, we are going to put the spotlight on just how ready is India. What is the level of our preparedness? The number of hospitals, isolation wards, testing centers, medicines, masks. What is it that we need and do we have enough of it? What is it that you can do? Are you ready? Are you prepared for coronavirus now that it's actually arrived in India? This is how things stand right now. There was one case that was first detected in Delhi, and then the family members of that one person also tested positive. In fact, just to track where all they went, where all they ate, and they traveled, the school that the child went to had to be shut down. The people there also were advised to go and get themselves tested. The child had actually traveled to Agra, and then in Agra as well, there was an alert that was put out and people were put under scrutiny, in isolation. In Rajasthan, it was essentially the Italians who came as tourists, 16 of them, plus their driver, who is an Indian, who've now tested positive and have now been put in an isolation center. In Telangana, it was that one person, but there are many others who are now under scrutiny in isolation wards and being tracked. The person, of course, was traveling from Bengaluru, so there's a lot more which is happening in Karnataka and Bengaluru as well. In that bus that he took, the co-passengers in Bengaluru where he stayed, people he stayed with, all of those people have also been put in isolation centers and are under scrutiny. Kerala, of course, those 3 cases are not fresh cases. Those are the older cases where people have already recovered and gotten out. That was in the first round that we saw of coronavirus come to India. Those ones were the people who had directly traveled from China, from the Wuhan province. The others now are actually from other places. So just how ready are we? And of course, the spotlight also is on the national capital, because that's where you also get a lot of people coming in from all over the world, landing in Delhi and then traveling to various parts of our country as well. Is Delhi ready to tackle this? That's the big question. I'll have Mr. Satyendar Jain, the Health Minister of Delhi. In fact, he's ready and live with us right now. Good evening, Mr. Jain. Mr. Jain, I'm given to understand that, and today Mr. Kejriwal spoke about it, there's a special task force that has been set up by the Delhi government. Now, what will this task force do?
देखिएगा, ये मेड ए टास्क फोर्स जो दिल्ली में सभी जो सीनियर ऑफिसर्स हैं उनको उसमें इन्वॉल्व किया गया है. सभी डिपार्टमेंट्स के ऑफिसर्स को लिया गया है. दिल्ली सरकार के जितने भी सेक्रेटरीज हैं वो हैं, सारे एमसीडीज हैं, डीएमआरसी है, पुलिस है, सबको लिया गया है ताकि एक कोऑर्डिनेटेड इफेक्ट टॉप लेवल पर, मुख्यमंत्री के लेवल पर हम उसको कोऑर्डिनेशन कर सकें. रीज़न क्या है कि देखिएगा, इसके अंदर सिर्फ ट्रीटमेंट नहीं है. ट्रीटमेंट इज़ वन पार्ट, उससे ज़्यादा इंपॉर्टेंट है कि इसको फैलने से कैसे रोका जाए. उसमें हमें सभी लोगों की इन्वॉल्वमेंट की ज़रूरत है. तो आज सभी को मिलकर उनसे मीटिंग की गई, उनको स्पेसिफिक टास्क बताए गए कि आपने स्पेसिफिकली क्या क्या करना है.
फिलहाल जो आपने आइसोलेशन सेंटर सेटअप किए हैं, 25 हॉस्पिटल्स जो है इंक्लूडिंग 19 गवर्नमेंट रन हॉस्पिटल्स और 6 प्राइवेट हॉस्पिटल्स में हैं, और इसके अलावा क्या प्रिपरेशन है, क्या दिल्ली के अस्पताल में जहाँ से देश भर से लोग आते हैं इनफ इंफ्रास्ट्रक्चर है अभी कोरोना वायरस से डील करने के लिए?
देखिएगा, अभी तक दिल्ली में एक कंफर्म केस है जो दिल्ली है, तो हमने अभी 230 बेड्स का प्रोविज़न किया है। अगर हमें ज़रूरत पड़ेगी तो हमने प्रिपरेशन कर ली है, हमें इमीडिएटली अगर नंबर्स को बढ़ाना होगा तो हम बढ़ा देंगे, उसमें कोई इशू नहीं है। बट 230 बेड्स आइसोलेशन बेड्स हमने तैयार कर लिए हैं जिसके अंदर हम लोगों को रख सकते हैं। अभी तक हमारे पास उसमें आइसोलेशन बेड में ऑक्यूपेंसी नहीं है, बट जैसी भी ज़रूरत पड़ेगी तो वी आर प्रिपेयर्ड। हम ज़्यादा ज़रूरत होगी 500 की, 1000 की, तो भी हम करेंगे।
क्या ऑप्शंस मिस्टर जैन अभी कंसिडर किए जा रहे हैं कि कहाँ पे हम एडिशनल स्पेस बनाएंगे अगर और लोगों को, क्योंकि चाहे इन्फेक्शन का एक ही आदमी को हुआ हो पर उसके वजह से एज अ प्रिकॉशन आप 80 से 100 लोगों को अब हम आइसोलेशन वार्ड में डाल के स्क्रूटनाइज कर रहे हैं। अगर ये नंबर बढ़ा तो हमें एक्स्ट्रा स्पेस चाहिए होगी।
नहीं
इसके
देखिए,
लिए क्या सरकार सोच रही है?
देखिएगा, जैसे 88 नहीं, जब तक पॉजिटिव नहीं है कोई, उसको ज़्यादातर लोगों को घर में ही क्वारंटाइन किया जाता है, उनको कहीं आइसोलेशन वार्ड में नहीं रखा जाता है। जैसे अभी जो एक पेशेंट है जो पॉजिटिव मिले हैं मिस्टर दत्ता, तो उनके उनके कांटेक्ट में 88 लोग आए, सबको हमने स्कैन किया, तो ज़्यादातर लोगों को घर में क्वारंटाइन किया गया है कि भाई आप घर के अंदर ही रहिएगा। जब तक कोई पॉजिटिव नहीं आता उसको हॉस्पिटल में ले जाने की आवश्यकता नहीं है। तो इसलिए मैं बता रहा हूँ कि हमारे पास जो अभी कैपेसिटी है दैट इज सफिशिएंट। जैसी बढ़ाने की जरूरत पड़ेगी देन वी विल इंक्रीज इमीडिएटली, और वो हॉस्पिटल्स में ही करनी होगी।
एक चीज जो बड़ी लोगों से निकल के आ रही है, ऑफ कोर्स इसमें थोड़ा सा पैनिक एलिमेंट भी है कि हमारे पास दवाइयों की कमी हो सकती है, पैरासीटामोल नहीं मिल रही है बाजार में, या हैंड सैनिटाइजर्स और मास्क की शॉर्टेज हो रही है। दिल्ली में इसकी क्या प्रिपरेशन लेवल है अभी?
देखिएगा, मैं आपको 1 बाय 1 बता देता हूँ। पहली बात, हैंड सैनिटाइज़र की तब ज़रूरत होती है जब आपके पास हैंड वॉश करने की पॉसिबिलिटी नहीं है। आप घर में हैं, ऑफिस में हैं, जहाँ पर भी हैं, तो आप हैंड वॉश कर सकते हैं। तो दैट इज़ द फर्स्ट प्राइमरी जो आपको प्रोटेक्शन है। आप अपने मुंह को, नाक को और आँख को टच करने से पहले हैंड्स को साबुन से अच्छी तरह साफ़ कीजिएगा। हैंड सैनिटाइज़र की ज़रूरत तब पड़ती है जब पानी से आप हाथ को नहीं धो सकते हैं, और जनरली ये हेल्थ फैसिलिटीज़ में ज़रूरत पड़ती है, क्योंकि डॉक्टर्स को बार बार या पैरामेडिक्स को बहुत बार उसको हाथ वॉश करने की, मतलब वॉश मशीन में जाने की ज़रूरत नहीं होती है, तो हैंड वॉश सैनिटाइज़र से करते हैं। तो मुझे ये कहना है कि आप सैनिटाइज़र को ये मत मानिएगा दैट इज़ द ओनली प्रोटेक्शन। वो एडिशनल है। अगर आप पानी से हाथ नहीं धो पा रहे हैं तो साबुन से और पानी से अच्छी तरह से हाथ धो लीजिएगा। सैनिटाइज़र का ज़्यादा इशू नहीं है। दूसरी बात, मास्क की बात है। जहाँ तक देखिए, मास्क की ज़रूरत उनको है जो हेल्थ प्रोफेशनल्स हैं, जो लोग इनका इलाज कर रहे हैं या उनके कांटेक्ट में हैं, उनको मास्क की ज़रूरत है, और दिल्ली सरकार के पास एनफ क्वांटिटी है मास्क की, उसके अंदर कोई दिक्कत नहीं है। दूसरा इशू ये है कि मास्क उन लोगों को लगाने की ज़रूरत नहीं जिनको कुछ नहीं है, जिनको सिम्टम्स हैं और जिनको ये बीमारी है उनको लगाने की आवश्यकता होती है ताकि ये फैले ना। तो सबको बताने की ज़रूरत है कि भाई मास्क के लिए ऐसे ना करें कि भाई हर आदमी मास्क लगा के जाएगा तभी बात बनेगी। मास्क इज़ ओनली जिसके पास ज़्यादा छींक आ रही है, आपको खांसी है, जुकाम है, तो प्रोटेक्शन इसलिए ले सकते हैं कि दूसरों को ना फैले। अदरवाइज मास्क की जनरल पब्लिक को जरूरत नहीं, हेल्थ प्रोफेशनल्स को जरूरत है। हेल्थ प्रोफेशनल्स के लिए हमारे पास मास्क भी सफिशिएंट क्वांटिटी में है, जो प्रोटेक्टिव गियर होते हैं वो भी हमारे पास एनफ क्वांटिटी में है, उसके लिए हमारे को पूरा इंतजाम हमने किए हुए हैं।
इनफैक्ट
और मेडिसिन के लिए देखिएगा, कोरोना वायरस के लिए अभी स्पेसिफिक मेडिसिन कोई नहीं है
जी,
अभी कोई स्पेसिफिक मेडिसिन इसकी नहीं बनी है। नॉर्मल सिम्प्टोमेटिक ट्रीटमेंट होता है ज़्यादातर, जो भी मतलब अगर बुखार है तो बुखार की दवाई दी जाएगी। उसी तरह का है कि भाई जनरल हेल्दी कंडीशंस को मेंटेन करने की जरूरत होती है।
जी। इनफैक्ट मैं मुझे लगता है कि शायद आपकी सरकार को ये अवेयरनेस कैंपेन चलानी पड़ेगी सत्येंद्र जी, क्योंकि अभी भी जब हम बात कर रहे हैं तब भी और इन्फॉर्मेशन आ रही है, दिल्ली में तो नहीं पर गुड़गांव में और आसपास के एरियाज में, जहां स्कूलों ने बच्चों को बोल दिया है कि मास्क पहन के आइए। सीबीएसई ने भी बोल दिया आप मास्क पहन के आ सकते हैं, सैनिटाइजर लेके आ सकते हैं। तो इस तरीके से अगर चलेगा तो शायद एक थोड़ा पैनिक और शॉर्टेज का प्रॉब्लम हो सकता है, और यहाँ पे शायद आपकी गवर्नमेंट का और सेंट्रल गवर्नमेंट का एक बड़ा रोल होगा।
मैं आपको ये बताना चाहता हूँ, देखो नहीं, देखिए हमने आज से ही स्टार्ट कर दिया है, ये कैंपेन स्टार्ट कर दिया। आज भी हमने सभी अखबारों में विज्ञापन दिए थे, कल से एफएम पे भी स्टार्ट कर रहे हैं। लोगों को एजुकेट करने का पूरा वेल थॉट ऑफ प्लान बनाया गया है ताकि उनको ज़्यादा से ज़्यादा एजुकेट किया जा सके। मुझे लगता है पैनिक करने की ज़रूरत नहीं है। मैं आपको ये बता देता हूँ, पैनिक करने से कुछ नहीं होने वाला है। इसका बहुत ही सिंपल प्रिकॉशन है। देखो, इसका कोरोना वायरस का अभी तक इलाज तो नहीं है, बट इससे बचा जा सकता है। बहुत ही सिंपल तरीके हैं। पहला, आप ज़्यादा भीड़ भाड़ के इलाकों में ना जाएं। दूसरा, लोगों के बहुत पास ना जाएं, जिसके भी लगता है कि खांसी है, स्नीज कर रहा है, जुकाम है, तो उनके बहुत पास ना जाएं। तीसरा, क्योंकि जो लोग जिसको मतलब इन्फेक्टेड पर्सन है, उसने स्नीज किया या खांसा, तो उसका किसी भी टेबल के ऊपर कहीं पर भी टच करने से वायरस आ सकता है, और उसकी जैसे बताया जा रहा है कि 4 या 5 दिन की लाइफ है, तो 4-5 दिन तक वो जिंदा रह सकता है किसी सरफेस के ऊपर। आपने हाथ से उसको टच किया, हाथ से टच करने के बाद वो आपके हाथ में आ गया, तो अब आपके अंदर जो बॉडी में जाने के सिर्फ 3 ही रास्ते हैं, आपका मुंह है, आपकी नाक है और आपकी आँख है। तो आप ये कसम खा लीजिएगा कि जब तक हाथों को अच्छी तरह साबुन से साफ़ नहीं करेंगे, तब तक अपने मुंह को, अपनी नाक को, अपनी आँख को टच नहीं करेंगे। मुझे लगता है कि सब लोग इससे बच सकते हैं। सबसे इम्पॉर्टेंट यही है कि हम प्रिकॉशन लें, और सभी लोग प्रिकॉशन लेके चलें। अननेसेसरी हम पैनिक करेंगे तो पैनिक करने से क्या होगा कि हम प्रिकॉशन लेंगे नहीं और पैनिक करेंगे, उससे ये
जी
फैलने के चांस बढ़ेंगे।
जी, सत्येंद्र जैन जी, शुक्रिया हमसे बात करने के लिए और आज टाइम देने के लिए, हमारे दर्शकों को ये भी बताने के लिए कि क्या लेवल ऑफ प्रिपेयर्डनेस है दिल्ली सरकार की और दिल्ली के अस्पतालों में। थैंक यू सो मच फॉर जॉइनिंग अस। बिफोर आई गो अक्रॉस टू आवर पैनलिस्ट, आई वांट टू क्विकली गो अक्रॉस टू रिपोर्टर्स फ्रॉम वेरियस सिटीज एज वेल, जहाँ पे केसेस आए हैं, जहाँ पे गवर्नमेंट्स ने वेयर दे हैव set up special centers. Before I go to Ayushman, who's also joining us from Delhi, I want to go across to Neha Hebale. Neha, Bengaluru is actually where the person who's tested positive from Hyderabad was staying. And after that, the Karnataka government held an emergency meeting. What are the kind of steps that the government has taken? How many testing centers and isolation wards do we have?
Well, Tanvi, as of now, 9 private hospitals across Bengaluru, have the isolation wards. And apart from that, we're talking about all the government hospitals in Karnataka having isolation wards. Now, this apart, we're also, talking about, like you rightly said, the testing centers. There are 2 testing centers. Let's begin with the one where we are right now at the Rajiv Gandhi, Institute of Diseases right over here. So, as you can see, this is a simple do's and don'ts, board that has actually been put up over here, by this institute. Very simply written, it says observe personal hygiene, frequent hand washing with soap, seeking medical attention promptly. Now, those are among, the do's. And also, of course, as we have been reiterating, the don'ts include, travel plans if sick, do not travel to China if essential, unless essential, and also avoiding contact with live animals, consumption of raw and undercooked meats. Now, these are also, some things that in fact have been highlighted. Now, apart from that, the government of Karnataka has also put up these do's and don'ts in many public spaces, such as the bus stands, the metro stations. And right here in the far distance, of course, what we are showing you is the isolation ward that we're standing outside, where, you have a team of doctors and medical professionals who are attending to all those who've been coming down from the morning, just getting their blood tested and awaiting the results in about 3 days. That's how long it's going to take, is what we are really picking up at this point. So this is, of course, ideally what the setup is like in, one of the bigger centers over here in Bengaluru. We're given to understand that people, have been coming down from the morning over here to this center. And apart from that, we're also talking about campaigns that have, been taken up by the government of Karnataka, by the health department as well. One good thing that, of course, the people have to look forward to at this point in time is all of those whose reports were expected today have, in fact, turned out negative. So there's no real cause of, panic at this point in time in Karnataka. But having said that, the number of people that have, of course, started visiting these testing centers has definitely, gone up over the past 2 days.
All right, Neha, thanks so much for bringing us that update from Bengaluru. Quickly traveling across to Hyderabad as well, which is where one of the patients has tested positive. Many more, Paul, are also under the scrutiny, are also being tracked right now and have been quarantined. What is the level of preparedness, by the Telangana government?
Well, the number of patients being observed closely is very high in Hyderabad, especially because, Tanvi, that particular patient from Dubai had traveled to Bengaluru. From Bengaluru, he took a bus which had 27 people on board. So the couple of days, that is 4 to 5 days he was there in Hyderabad, he visited Apollo Hospital as an outpatient, which meant almost 80 to 100 people were in close proximity to him, which only means that they had to trace down each one of them. They had to monitor them very closely. And at the moment, 47 people's samples were taken. Those are the people who were in close proximity to the 24-year-old patient. And then out of that, 45 turned out to be negative. So according to preliminary tests, 2 more cases have come to light from Hyderabad. Those 2 samples have been sent to NIV Pune. Only tomorrow afternoon we will have a confirmation whether the number from 1 has gone up to 3. That is the number of positive cases. Apart from that, 100 crores has been released by the Telangana state government. 3,000 beds have been identified for isolation wards in 5 hospitals in Hyderabad and 1 in Vikarabad district. Apart from that, private hospitals also have joined hands. They have isolation beds as well. Also, the Health Minister Itala Rajendra announced today that so far it was only the government hospital, that is Gandhi Hospital, that was collecting samples and isolation wards were set up. But today they announced that private hospitals can also treat patients and collect samples. Then it will have to be sent to Gandhi Hospital. So they are trying to make the procedure much more easier. Apart from that, the metro being sanitized, a lot of efforts in campaigning and letting the people know there is no need to panic or take tension. Be informed, take care, and we can fight this together is the message that Telangana government is conveying.
All right, Paul, thanks so much for joining us live and bringing us that update. I just want to quickly go across to Ayushman, who's also live from the national capital. And we were just hearing from the health minister as well, Ayushman. But the other one aspect that came out earlier in the day was that the medical staff in Safdarjung Hospital didn't have masks themselves. After they raised this issue, it got highlighted. We are given to understand they were given masks. Are the Delhi hospitals really prepared to tackle this?
Well, at least the government is claiming so, Tanvi. In fact, the Delhi government has said that they have got 25 of the hospitals in a condition where they can handle this situation. 19 of them are government hospitals and 6 of them are private hospitals. Important aspect is 12 centers are there where people can go and get testing centers are there, Tanvi. And in addition to that, we have All India Institute of Medical Science, we have RML, and we have Safdarjung. So in the national capital, you have the advantage of better health facilities at least. And currently, when we pose this question to the Delhi government on the availability of stock, be it the mask or the medicine, the government is firmly saying that they have got enough stock. In fact, the MOS Health told us that there is no deficiency of any mask or any kind of mask or any medicine. So they are saying that they are well prepared, but the only fact is the integrated disease surveillance program which is taking place, because we are seeing the kind of cases which are coming up. So the government is also saying they are trying to ascertain all those people with whom the infected patient had met. Now that becomes a real challenge, and for that, if you see, that is the one thing which Union Minister Harshvardhan pointed out. That would remain a bigger challenge in the national capital as per the Health Ministry officials.
All right, Ayushman, thanks so much for bringing us the update from the national capital as well. And even as we speak, while he was giving us an update from the Delhi government, the Haryana government will also have to start taking a closer look at what's happening, because there's one employee of Paytm in the Gurugram office of Paytm who's now tested positive. Employees who worked with him have also been advised to get themselves tested, and Paytm employees in Gurugram and Delhi have now been told that they can work from home until the office premises are completely sanitized. So that's what's happened. Let's also say good evening to Anjali Nair, Senior Vice President for Global Health Strategies, who joins us this evening. Dr. Navin Dang, Consultant Microbiologist and founder of Dr. Dang's Labs. Rajib Das Gupta, Visiting Faculty at Global Disease Epidemiology Control Program at Johns Hopkins School of Public Health and Professor for Community Health at JNU. And Shai Jamil, former group leader of virology at ICGEB, will also be joining us shortly. But I just want to go across and start with Anjali Nair. Anjali Nair, let's begin by talking about what our record has been so far in dealing with such outbreaks, from Nipah to Zika or swine flu. How has India dealt with such situations?
Thank you so much for including me. So, as you know, with Nipah, the Kerala government really showed a sense of urgency, and they did manage to contain it. With H1N1, we did have a panic to begin with, and then when additional facilities, particularly the private diagnostic labs, were included and people could test and get treatment, the panic went down. I'm sure all of you remember the long queues, especially in Pune. That visual is really, really still very vivid in my mind. But I think we did a good job at that point of time. The vaccine was procured very soon, and what I have to say here is that when the government of India decides to do something, they can do it very well. And polio is a very good example. When we decided to take it on an emergency footing, we managed to do it. So here, I think at the moment we hear the Health Minister of Delhi, we've seen the Union Health Minister, Dr. Harshvardhan, talking about it and saying how they are prepared. They're giving out all the right messages, right informations. We've got the screening facilities. The challenge here is that not much is known about the virus. It is a new virus, and we've seen the cases jump over the last 3 days in Delhi. And I think a big test will be how we manage to contain the spread and how we manage to treat people.
What should be the core focus for the government right now? And let's begin with the central government and even the state governments. Mr. Rajiv Das Gupta, obviously what they are right now doing, and the way we can see it, is they are mapping out the movements of each person who's tested positive and then taking all those people that they may have come in contact with and putting them, quarantining them. What else can the government do at this point?
This is a new disease, a new virus, and the game plan is as follows. It actually entails two separate, somewhat separate game plans. One is screening and handling the international travelers and their contacts, and second, which is actually far more difficult, is how the country or an individual local health authority, including a state authority, is prepared for handling community spread. And these are not the two, and these two are not the same things and often are being conflated. The screening of international travelers, categorizing them, following them up, is actually in place. The greater challenge is how we are going to handle the community spread. And that entails working with communities, working with schools, and most importantly, working with employers. I don't think we actually have that, because we actually have knee-jerk reactions now. 5 schools declaring that they are going to close. Do actually schools have been shared a plan with? Have employers been shared a plan with? Those really are the critical issues in handling or at least minimizing community spread. International travel or import through international travel is something which cannot be entirely avoided because of the global travel network, because the very large number of passengers and professionals that are constantly traveling into India from other countries. But the bigger challenge is, and that's where I believe some of the weaknesses are potentially going to be there, is how we handle the spread at the community level. And that's a far more complex game. I'm not going into the details right now. We can talk about it.
Okay, the other aspect, and I actually wanted to speak a lot more about this, is Dr. Dang, the kind of precautions that we as a community can take. We are being told don't go too much to mass gatherings or public places, but until and unless the schools shut down or offices shut down, people will have to take public transport, people will have to travel in buses, in metros. So then how do we ensure that we keep ourselves safe?
First and foremost, I would like to emphasize the point that please do not panic. That's the most important precaution to be taken. Do not panic. We have to be cautious. We have to be careful. Yes, it's a respiratory infection, which is a droplet infection transmitted from one infected human being to another one. So the only precaution to be taken is that do not go close to a person who is a suspect or has a history of travel. But like making your life come to a standstill by not going to school, by having the school shut down, by not using metros, etc., I think is a little injudicious. We just have to see that there's good personal hygiene maintained. Like what Mr. Jain right now said, that first and most important thing is that we should frequently wash our hands. We should see to it that we are not too close to a person who is coughing away. Sanitizers are required, but only if you're not able to wash your hands. We should use alcohol-based hand sanitizers. There's no need for anybody and everybody to start putting on masks. That's really weird. It is the patients or the contacts who should take care that they're not transmitting the viruses by covering them up, or healthcare workers who are going to be close to the so-called suspected patient who should be wearing masks. And otherwise, just see to it like railings, doorknobs, flat surfaces where we expect that anybody could have coughed. We do not touch them. There's no need for everybody to wear gloves, but to see that for the vendors, for the different suppliers, to see that their area where we expect visitors to be is absolutely kept clean. That's what I'm trying to say, is that absolute good personal hygiene. The gloves should be properly discarded. The masks which are worn, they should be worn properly, and even when the masks are being taken off, they should be taken off properly by just opening on the back side, not touching the front side. Do not touch your face too often. Just see to it, like it's well said, that the only way of getting the virus is either through the openings of the body, that is through the eyes, through the nose, or through the mouth. Take care that we do not touch our face very often. And these basic precautions, I think, will help in taking things forward.
So then, yeah, let's talk about the infrastructure which is present and just what do we need over there. Rajiv Dasgupta, it's no surprise and it's no secret that India's healthcare infrastructure isn't, by any standards close to what we need. Just one statistic that I want to specifically point out right now is that according to a study that was published in Lancet a year and a half ago, 1.6 million people die in India every year due to poor quality of healthcare. We need 20 times as many virologists as we have right now. Does that become a hurdle when we have to tackle outbreaks like this?
We are actually dealing with a very large-scale public health emergency globally.
Yes.
How exactly or how fast it would spread in India, only time will tell. While on one hand, individuals don't need to panic, governments and health authorities actually need to prepare at a very significant scale. The question is whether we are prepared at that scale, or we are going to prepare, or we are going to respond or react to each individual case, and that, I think, is the test at this point. As far as preparations go, there are preparations of how you prepare what's called first responders, how you prepare actual healthcare workers, what's the kind of advisory that's going on, what's the kind of preparation at the community level, at the schools, with the employers. These are the basic levels, and each level has a very, very detailed protocols laid out. The question is how strong local health authorities are in communicating this, in implementing this, and in monitoring this. Now, just for example, and I'm talking of global protocols, not what actually is happening in India or what ought to happen. So the global protocol is that employers have to be told to have an extremely lenient policy at this point, so that you do not really enforce your your leave rules. You are really relaxed about your leave rules, so that employees have the full independence of working from home. This is just one example. Similarly, I think there's a conceptual confusion whether you need to rush to get tested, whether you need to rush to a doctor, or whether, as some countries have actually instituted extremely robust mechanisms, that you actually have telephonic support, and you should be able to call your helpline, and it's through the local helplines that patients are actually supported and monitored at home, and only, and I repeat this, only if you have serious illness, then you actually need to go to the hospital. The whole idea is that you do not hail a taxi and go to the hospital, which is exactly what happened in UK, in one case, and that's exactly what UK is not doing since then. So I think a fine distinction needs to be made between the general advisory that we often, that we almost as a rule give out, that if you feel sick, contact your doctor. the idea here is not really to rush to the doctor, because the moment you go out, you are potentially a contact of dozens, if not almost 100 contacts, and it's and a point will come when it's physically impossible for a country as large as India, or for cities as dense as Delhi or Mumbai and Bangalore and Hyderabad and so on, to actually be able to keep tracking contacts. It's a Herculean task, and it's an impossible task. And therefore, the trick of this game is how you actually cut down on potential contacts, and that requires extremely strong public health systems rather than merely the platitude of don't panic, don't panic. That's only at one level, but that's not really the organizational level.
Okay, so that's at one level, but the governments obviously have to be on their toes and have to move ahead of this so that they can help contain it better. Anjali Nair, the government today in its news briefing came out and said that we're building a database that will also help us, track those patients better and where all they've gone, and possibly people who can be affected, and essentially a surveillance database that will help us contain this. Now, how prepared is India to do that right now? Because right now, of course, we just have 7 to 8 different instances, but what if tomorrow there are 50 of such instances?
So I think that's a big challenge. To me, I want to actually continue a little bit from what my previous speaker said, and it's really going to the communities. I don't think the message at the moment is really getting across all people in India. It's still very constrained, although the media is doing a great job, and although the Delhi Health Minister said that yes, they are beginning to get the message out. But unless communities are prepared and they know the do's and don'ts, we are going to face a challenge. Here, the problem is not just what the doctors do, but also how people respond to this epidemic. It's all very easy for us to say don't panic, and yes, we shouldn't. But when people don't have the full information, they are going to panic. So I think the contact tracing is going to be challenging when we get to the communities, which is why communities need to be prepared. That's one. The second thing is we really need to make sure there is no misinformation. We get all kinds of messages about all kinds of treatments that people can take, and that is not going to prepare communities. So I really think that the states are showing urgency, but there needs to be a little more urgency coming right from the center to the state chief ministers, who need to look at the preparedness with the chief secretary and with the district magistrates. It's only then, when you do the contact tracing and you build a database, you need to have that cooperation and collaboration between the center and the state.
Let's also say good evening to Shahid Jamil, former group leader for virology at ICGB and CEO for Wellcome Trust, DBT India Alliance. Mr. Shahid Jamil, the focus right now is just how prepared are the state and the central governments. One part, of course, is what Anjali Nair was just highlighting. Would you like to add to that? Right now, the governments seem to tell us that they're all ready, that they have enough number of testing centers and isolation wards, and they're tracking those who have been infected and people around them.
Well, you have to understand that the test that is available today is not really testing populations. This test is testing people who are suspected for one reason or the other. They may have a fever, they may have a runny nose or something like that. So they have to get to a testing center. So we really don't know the actual number of cases at this point. Coming to the government's response, I think the government's response has been mature, has been to ensure that there is no panic. But I think we need to now move to the next level. The time for taking temperatures at airports is over. We need to get into more proactive screening. So if, for example, the worldwide data shows that mortality, deaths are taking place in people with some underlying condition, some other chronic condition, we need to start actively looking at those cases in hospitals to address this issue at the next stage.
Okay, because Mr. Jamil, right now the government says that they have now begun to screen almost everybody. It's not just people coming in from a few countries, but all travelers who are landing in will be asked, and of course, any which is asked to reveal their travel history, and basis that they will start screening people. But you're saying while that should be done, we need to now go to the next step and look at other people who may be vulnerable already in our country and in our hospitals?
Yes, so what I'm saying is that it's time now to move to something called sentinel surveillance.
Okay.
Which means that people that are in vulnerable groups need to be also looked at. I mean, thankfully, we've had no deaths so far. India has 28 cases as of today. 22 were announced today. So thankfully, no mortality yet. So this is really the time to step up the surveillance to the next notch.
Do we have enough testing centers, Dr. Dang, to deal with this situation? In a lot of cases, we were told, well, the first test was done, they tested positive, but we are waiting for the second test, and the samples have been sent to the Pune center. In our country, do we have enough centers to start doing this at a larger scale then?
Well, as far as I'm aware, no. Because the procedure is as such. The patient, once suspected, is taken to one of the isolation wards in a designated hospital. The sample is taken. I'll talk about Delhi at the moment. The sample is taken and sent to All India Institute of Medical Sciences, where they do first what is called a screening test by a method called real-time PCR, where they look for an E gene. If that is positive, then the sample is sent to National Institute of Virology, where they do a confirmatory test, which is looking for the G gene and for the two other R and RP genes. And if either of them is positive, then only we declare a patient as suffering from coronavirus. Now, my point is that the whole process takes a few days. I think we are very well equipped in the city of Delhi itself or in the country in different states where we can set up centers for screening and for testing and then releasing the reports and having the patient diagnosis at a much faster rate than what it is now. I do not know about other states, but in my opinion, at least in Delhi, there should be few centers set up where the results are available fast and accurate.
Well, if you're saying that that's as far as Delhi is concerned, I'm not too sure what it will be outside, in smaller towns. Anjali Nair, would you want to weigh in on that? Because that's going to be the most important part, testing samples to figure out just how many people may have been infected.
You're absolutely right, and I think Dr. Dang has really said the right thing. Today we have relatively smaller numbers. God forbid if the numbers jump. With this few facilities and tests going to the Virology Institute in Pune and back is going to be time consuming, and we will need faster results. So I think this is the time for the government to set up private with partnerships with labs. We did it for H1N1, so we have certain protocols in place. So I think that is the need of the hour to make sure, and that's the preparedness I was really talking about. It's not just, there have to be enough testing facilities across the country. There have to be enough drugs available. There should be information provided to the people so that they know how to respond and react when they have a fever or sneezing or cough or any of the symptoms. And finally, we need to make sure that there are protocols in place for protecting health workers. I mean, we, in any case, don't have enough nurses, doctors, or frontline workers. And if they start falling sick, then we really have a challenge on our hand. And even, for instance, the protocols for airline staff. I mean, we now have the Air India flight with the staff which is put for 14 days quarantine. I think these are the kind of preparedness that on an urgent basis we need to get done. And I'm sure the government is thinking about it. I think we just need to be ready with it tomorrow.
Yes, actually, and I was going to raise just that issue next. because we had one instance in Chennai a few days ago where the hospital staff literally, started to protest, saying that we are not being given enough protective gear, we are not being given enough infrastructure to tackle this situation, and we are being exposed to this risk. Today in Safdarjung Hospital, at one point, there were medical staff who were saying that they're not even being given the basic mask that is required before they start treating these people and testing people. Is that going to be a big concern, Mr. Dasgupta, the fact that let alone a Delhi or a Chennai, but in other smaller cities and towns, our medical staff may not be equipped, right?
That's always a primary concern, and particularly in a disease condition such as this, protecting health workers is really a preeminent requirement. Let's also keep in mind that the WHO cautions that there is a global shortage, and that the production of personal protective equipment needs to be augmented by as much as 40%. And given what global supply chains are, we know that a lot of it is China-centric in a sense, and that's a source that's currently somewhat compromised. And therefore, taking stock of what's available, how do we regulate, and as Dr. Dang said, that everyone doesn't simply need to use a mask. But a mask is just one of these things. The critical challenge is when you have a far higher number of patients actually getting into the intensive care stage. And now, thankfully, that's still not an issue right at this point, but I do foresee the requirement for intensive care as cases are certainly going to increase. The critical challenge at that point is, as someone also earlier said, that with a large or a fairly large proportion of higher level care, advanced supportive care in secondary and tertiary private sectors, how the government is going to actually be able to collaborate with the private sectors, particularly if cases actually go up and particularly if community spread keeps happening. We also need to remember that India is also, simultaneously we have the NCD epidemic, a very high number of diabetics, chronic kidney conditions, and so on, all of which are actually ripe conditions for added complications in influenza, or in this case the COVID. And therefore, the preparedness for intensive care is at another level, and that certainly entails a whole lot of preparedness, including personal protective equipment, and the demands of intensive care are far larger than what we are actually witnessing now. Now it's actually a relatively low level of demand, and if this news report is true, that a teaching hospital actually has shortages, or at the very least health workers had this perception that they're not feeling safe, that's really a warning signal of paying attention to that level.
Yes, absolutely, which is why, the minute we were given this information and we highlighted in both instances, thankfully the authorities responded. But my only fear is that this should not be cases in more hospitals, because the medical staff needs to be given what they require to deal with this situation in the coming days, especially if number of cases go up. I have a viewer on the phone line. Vinod is on the phone line calling us from Nasik with a query. Good evening, Vinod. Go ahead, please.
Hi, thanks for taking my call. I had two queries basically. First, I have recently traveled from UAE to Nasik. So should I go for a test to verify, and if in that case, which test I should be getting it done?
Vinod,
that's my question.
Okay. Are you showing any of the symptoms already?
Other than runny nose, nothing else.
Okay, Dr. Dang, and this is perhaps what a lot of people with cold type symptoms may be wondering, what should they do?
A very pertinent question and well asked. I think no test is required at this stage if the patient does not develop any fever. The patient should be staying at home, should be self-quarantined, should not be moving out, unless until the patient develops some cough, some other chest infection and fever. If that kind of an infection occurs, then they should contact the local hospital where the testing facility is available, Like I said, what test? There's only one test, that's the PCR test. The sample will be taken at a local hospital in Nasik, and then that sample will be sent to the relevant closest lab, where they do first a screening test. You should get the report within about 2 days or so, and after about 2 days or so, you'll be tested, you'll be declared either positive or negative. One more thing which I would like to explain to you is that the incubation period of this varies from 3 to 15 days, with a median of about 5.2 days. So if you have crossed about 2 weeks after having traveled, and you have not developed any other serious symptoms, no cough, no chest infection, no fever, then you can absolutely be calm about it. But if you develop any of these other symptoms of fever and respiratory infections, then yes, definitely go to the closest hospital and give a sample and get yourself tested.
All right, I hope that helps. Vinod, who called, that detailed reply that you gave. Thank you so much to all of our panelists who've joined us. Over the last 2 hours, we've attempted to really arm you with as much information as possible about coronavirus. We've attempted to separate the myths and the fake news and the false information from what the facts are that we know of right now. We've attempted to tell you what you should do to take care of yourself, to avoid getting infected, to try and stay away from public spaces, mass gatherings, keep yourself clean, ensure that you're yourself in a hygienic state, and around you hygiene is maintained. If you do have some of the symptoms that are known to be linked to coronavirus, then there is a helpline number that you can call. Quarantine yourself and try to just stay at home, not travel outside. If you still think that the situation is getting worse, get yourself tested. A mask is not essential unless you are infected, or if you're part of the medical staff that's treating these patients. If you're just a regular person who doesn't have any of the symptoms, you don't really need to be wearing a mask right now. I think that's the most important part. Hand sanitizers, yes. If you haven't, great. If you don't, doesn't matter, as long as you're able to regularly, frequently, properly wash your hands, a 20 to 25 second proper intense routine, and don't touch a lot of surfaces around you, you'll be fine. No, you will not get coronavirus if you use a product that's been imported from China. That's not how it spreads. No, you will not get coronavirus if you start eating non-veg food right now. But yes, the basic precautions that you take to boost your immunity and stay away from any kind of viral infection, that's all we can do at this point. Thank you so much for joining us on this special broadcast.